Combating 2 side effects from Arimidex. Your doctor has prescribed an aromatase inhibitor like Arimidex for your anti-estrogen therapy. You understand that aromatase inhibitors reduce the risk of breast cancer recurrence. But what about the possible side effects? You've probably asked your doctor. The potential side effects of aromatase inhibitors are real, but combating serious conditions like osteoporosis and joint pain all start with understanding what's happening in your body. But before treating the side effects, let's do a quick rundown on how drugs like Arimidex work. Aromatase inhibitors block a process inside your body called aromatization. By inhibiting the enzyme aromatase, androgens are prevented from turning into estrogen and fueling your body. Ultimately, we want you to feel confident that your doctor's treatment path is the right one. So let's talk about combating 2 of the more serious side effects from aromatase inhibitors. But first, we'd like to thank our sponsor, the company who developed Breast Cancer Index, a test that may help women with ER-positive, early-stage breast cancer decide with their doctors whether to extend or end anti-estrogen therapy after 5 years. Number 1. Osteoporosis. Our bones are always undergoing a process of damage and repair, known as bone remodeling. This is a normal process where cells called osteoclasts are continually breaking down old bone, while osteoblasts repair the damage. While Arimidex reduces estrogen in your body to help prevent breast cancer recurrence, estrogen is also crucial for bone remodeling. Osteoporosis is a condition that leads to more bones being destroyed than repaired, leaving you at a higher risk for a break or fracture. Bones especially susceptible are those in your hips, spine, and wrists. So what can you do to protect your bones? Many of our recommendations are the obvious ones. Quit smoking and limit yourself to no more than 2 alcoholic drinks a day. Watch your caffeine intake and stay on top of your exercise and resistance training. Aerobics, dancing, jogging and walking, any activity that helps keep you upright can also help strengthen your bones. Also, consult with your doctor to make sure you're getting enough calcium and vitamin D per day. You may need a vitamin supplement if you're not receiving enough in your diet. As a survivor taking Arimidex, your doctor should have also done preventative scans. If they find weakening in your bones, then you might be prescribed a bisphosphonate or calcium and vitamin D supplements to help strengthen them. Our final tip is to also be proactive about your bone health, whether that means exercising, taking vitamins, or staying informed. Number 2, joint pain. Doctors aren't totally sure what causes aromatase inhibitor-related joint pain. Some suspect that the rapid drop in estrogen levels might actually lower your pain threshold, meaning your brain detects these signals better. Another possible reason is that lower estrogen levels can result in the release of cytokines, which may speed up the bone loss and aging, leading to pain. According to studies, joint pain most often develops in the first 3 months of therapy, usually forming in the fingers, wrists, hands, elbows, shoulders, knees, and ankles. If you're experiencing pain in your joints, then your oncology team may recommend anti-inflammatory drugs like ibuprofen, celecoxib, Celebrex, and if you're still in pain, then your doctors may prescribe medications like opioids or acetaminophen. We recommend asking your doctor about increasing your vitamin D intake. A small study suggested that high doses of vitamin D can improve joint pain and increase bone health. And although the opinions of the medical community are inconclusive, other studies suggest that acupuncture and gentle stretching may also reduce joint pain. Ask your doctor whether these are options you can explore as well. In the end, you should never be hesitant to talk with your doctor about your concerns. Osteoporosis and joint pain affect women regardless of their history of cancer. This is why it's important to take note of any side effects and to understand your care, both for your own sense of control and well-being. To get more practical tips for breast cancer patients, be sure to subscribe to Breast Cancer Answers here and leave your own questions in the comments below. We'll do our best to answer your questions in future videos. Finally, we'd like to thank our sponsor, the company who developed Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.